want to welcome you all to the Ask the Funder session for the Innovation Initiative I2 $1 million Milestone-based Challenge Grant. This is our 13th cycle for this funding program. We're very glad you're here, and we're glad you're interested in applying. I'm Karen Winston, Alliance Healthcare Foundation's Communications Director, and I'm helping manage this program this year with our program team. All right, so we're going to begin with some housekeeping tips before we get into the meat of the program. So as you can tell already, the session is being recorded and everybody is muted and off camera. Everything that we're going to be talking about today will be linked in the I2 webpage. We'll give you the address there if you haven't checked it out yet. For Zoom, questions and answers today, whether they're technical or otherwise, please use the Q&A feature at the bottom of your Zoom screen. Our team members, Jawad and Barb, are going to be monitoring that, and we have a section at the end of the program for questions and answers. So thanks very much for that. Today's agenda. We're going to be covering these topics today. Again, if you have questions, drop them in the Q&A at the bottom of your Zoom screen. You can do it as we go, or if you want, wait till the end and collect them and drop them in. But we won't be responding until the end of the presentation. All right, next slide. This is just a reminder of our mission and vision for Alliance Healthcare Foundation. This guides and informs our work every single day. And now for some I2 background and information. So with I2, we want to support population health improvement by helping innovations succeed, scale, and achieve sustainability. We also believe that your zip code, race, socioeconomic status, gender, or ability should not determine your life expectancy. Our goals for I2 are that we want to help nurture and scale sustainable solutions aimed at closing gaps in health equity, and that we're seeking market-based and or transformational systems change solutions with the potential to improve access, quality, and health outcomes for low-income residents here in San Diego County. Now, in case there's any confusion over the word challenge, as in the I2 Challenge Grant, I just wanted to let you know that we've called it the Challenge Grant for basically two reasons. One, this is a 9-month challenge to develop a successful, innovative solution. And two, your solution itself likely is challenging the status quo. Therefore, we've called it a Challenge Grant. There's no matching feature in this in case anyone had any confusion. So again, it's a 9-month capacity building and mentorship program. We continue to partner with our awardees long after the award has been made, even after the milestones have all been met. We want the grants to be deployed in support of developing and scaling the proposed solution. And our priority focus for I2 funding is, again, to close disparity gaps here in San Diego County. So this is a visual of the full I2 journey. It includes 3 distinct phases of capacity building and mentoring and spans 9 months of all of next year. We know this is a big time commitment, and therefore we've built in some incentive grants for semifinalists and finalists in phases 2 and 3 in order to support their work that will be done in building out the innovative solution. So in phase 2, we'll be awarding $5,000 each for up to 10 semifinalists. And in phase 3, we'll be awarding up $20,000 each for up to 5 finalists. All right, let's get into eligibility. So who can apply? I2 grant applicants need to be a 501c3 nonprofit organization. They could also be a state college and university described in tax code 511A2B, even if they're not described in section 501c3 of the IRS code. And 501c3 organizations may collaborate with social enterprises, provided that the lead applicant itself is a 501c3 nonprofit organization or a state college or university. We know that everybody's solutions are at different stages of development, and we allow for that. So your proposed solution can be in any of these stages. It could be not yet in operation and therefore early design stage. It could be young and maybe formed just last 2 years, but not yet serving clients. Or it could be emerging. You're starting to serve clients and starting to establish a presence with that solution. Or you could be well established and you have a customer base and generating revenue. These are all eligible innovations. Eligible proposals must meet all of these criteria. They must prioritize solutions that target root causes rather than alleviating symptoms, must have a clear sustainability plan that is not reliant on ongoing grants or philanthropic fundraising once scaled. They must involve those closest to the social health disparity in determining the solution using a health equity lens. They must demonstrate clear and measurable improved health outcomes and reduce disparities for clients. And finally, they must demonstrate how being awarded the grant would generate more impact than what is already being achieved by your organization. On the webpage, which is 2025 I2 Challenge Grant, we have a bunch of links. One link is to the full description of this program and goes into better detail than we're going to be able to cover in today's webinar. So feel free to download that, review it. If you have questions, of course, feel free to email us. We have a particular web email for the grant, which is I2@alliancehf.org. I'm going to be mentioning that a lot today, so you'll see it up on screen as well. But we are able to take questions that way as well after this webinar is over. All right, with that, I'm going to turn it over to our Executive Director, Sarah Lyman, as she talks about some of the evaluation considerations we have for the program. Take it away, Sarah.
Great. Thank you, Karen. Hi, everybody. As you can see, this is a fairly intensive program that spans many months. So we just want to kind of underscore that part of the intention with that design is that we invest a lot of funding and focus on providing candidates with highly customized mentorship, coaching, business accelerator support. So the goal, the hope is that, you'll have an opportunity to refine your idea, refine your business model, and strengthen that over time. And even if you're not awarded the 1 million, you'll still walk away with concrete tools that you can leverage to make a positive impact. On the screen now, you can see an overview of the evaluation components that will be considered at each phase. As you can see, they build as the initiative gets further in the stage for I2. And so in the initial phase, we'll be focused on the elements that you see listed under phase 1, proposal, and I'll go through each of them in the next few slides so you know what we mean by each of these words. So innovative. Does the proposed solution reduce disparities and create value for under-resourced and marginalized communities in San Diego by creating new or reimagined solutions to address critical issues related to health and wellness? So we're really looking for new or novel solutions to longstanding problems. Community informed is fairly straightforward, but is the approach informed and supported by the community it wishes to serve? Is there the ability for that community to be actively engaged in an ongoing, inclusive way? Next slide. Impactful. Again, fairly straightforward, but we're really looking for solutions that demonstrate that they're solving a real pain point and addressing a real need for constituents. We look at how deep and wide the potential positive impact is and how it would be measured. And is there an explicit racial equity lens? Feasible. Does the business plan make sense? Is the budget practical? Does it appear that this solution is likely to be successful? And then also, does the team have the experience, capacity, knowledge of local conditions, et cetera, to deliver those results and scale? Leadership team and coachability. So more on this front, but essentially, especially as we get further through the program, we'll have an opportunity to really see the team in action and understand if their experience and expertise is built into the team, or there's the ability to source it. We recognize, you may need lots of different types of expertise to make your solution successful. And then also, what's the experience been kind of going through the process? Is there, coachable? Is constructive feedback able to sort of be incorporated and modified as needed as the solution begins to continue to evolve? Evidence supported just means, is there strong evidence that the innovation will yield positive results for the intended communities? So this does not mean it needs to be listed in, evidence-based practice somewhere, but it does mean there's clear data that suggests this innovation will, achieve positive results. Additionality, we get asked this one a lot, like what do we mean by additionality? And really, this is a large grant for us. It's one of the largest grants that we make in the year, $1 million. And so it's important for us to understand how that investment will generate more impact than what would already happen without our money. So helping tell that story is also important and would be something we'd advise. Next slide. Scale and sustainability. This is an important one. Is there a clear and feasible sustainability plan that is not reliant on grant funding? We get we get questions about this a lot. We get a lot of applications for important nonprofit programs, but in order for them to continue delivering the impact, they require ongoing grant funds. This program for I2 is different than our general operating support grants. That's what those are for, because we recognize that's critically important. But for the innovation initiative, we're really looking for innovations that once scaled, they aren't reliant on grants to continue making impact. So for example, maybe there's an earned revenue element to the solution, or a systems change that once fully implemented will sustain the desired change. So just kind of think to yourself, like, how will this work continue after it's scaled without grants? And then is there clear potential evidence for successful growth and scale? Market understanding, this is a little wonky here, but we do want to understand if the team has a strong understanding of their TAM, SAM, and SOM. What the heck are those? Well, this means, do you have a grasp on the total population that could possibly benefit from your solution? And then within that population, who are the people that your solution is most likely to benefit? Maybe it's a subset, right, of like the total population. And then within that population, what's the realistic target market or audience that you think you can actually serve, that you could actually, capture, for lack of a better word, and support? And then, does the team demonstrate a strong understanding of local ecosystem to make the solution viable? This is another piece that we see a lot. So a good example here is that we often get applications for solutions that rely on future sustained funding from health plans or Medi-Cal in order for them to truly scale and reach sustainability. And sometimes those feel disconnected from real knowledge about how that system works. So that's a fine strategy, as long as you can demonstrate that your team and your business plan has a solid grasp on the realities of health plan funding ecosystem and a clear understanding of why your solution could feasibly be supported through that funding stream. That's just one example. And I will hand it back to Karen.
Thanks, Sarah. All right, we'll get, again, you may have questions on all those items or some of those items, and we can address those at the end or afterwards if you'd like. So at this point, we want to talk about the timeline, some key dates, and the journey aspect itself. So here is the timeline for phase one. It begins in February, and all applicants will be notified prior to February. We will allow the first cohort of up to 25 applicants to enter phase one. And if you need a more detailed calendar, again, on that webpage for 2025 I2, you'll find some additional calendar items. And if you're curious what the deliverables are going to be come April of next year, it'll be an executive summary and a pitch deck that you'll continue to refine all along the I2 journey. Again, here are the key dates that I mentioned before. And even though we don't know who's going to advance all the way to the finals, we really encourage you, if you do submit an application, to put a hold on these particular dates on your calendar, especially the presentation dates and the due dates for your deliverables. Again, this calendar is up on the webpage. We have help this year, as we did the last cycle. We have an innovation partner, NextCubed. NextCube's an international business accelerator originally based here in San Diego. Their business model includes historically Black colleges and universities and a founders initiative as part of their offerings. And NextCube prioritizes connecting underrepresented founders with a network of accomplished mentors and strategic partners seeking to ensure equitable opportunities for success. NextCube's role in our I2 program is to provide the entrepreneurial workshops, customized mentoring and coaching, and to serve as a thought partner to Alliance during the evaluation phases and milestone setups for the journey. This is going to be our second cycle working with NextCube. The first time was in 2022, and it was so seamless, you'd think we'd been working together for years. So we're confident you will find them to be a good partner as well. All right, now let's get into the application itself. So there are some resources for the application. Obviously, the webpage, which I continually mention. There's an FAQs piece on the webpage. There's a PDF of the grant application that you can download, which we highly recommend you do. Obviously, this funder session and tomorrow's, the recordings will be on the website, so you can review those as well. And lastly, we have an email address, i2@alliancehf.org, and we monitor that regularly and will respond just as quickly as we can to you. So to get started, the portal that we use for the application is called Submittable. It's like many other online application or online platforms that you've been on. It's going to require you to create a profile first, and then it'll walk you through the application piece of it once you get in. But one of the things I wanted to mention is that this application closes January 24th next year at 5 p.m. in Pacific Standard Time. We really encourage you to submit your applications days before January 24th, just in case there's any last-minute technical difficulties that could occur at the deadline. We don't anticipate any technical issues, but this is technology, right? So the earlier you can get your application turned in, the easier it'll be for everybody. Like submit it on Monday or Tuesday of that week, perhaps, if you haven't already submitted it by then. All right, again, some helpful tips. I mentioned the PDF in a version of the application a moment ago. Please download that. This is a long application. We apologize up front for that, but all the questions you're going to be responding to will give you the best opportunity to describe your innovation solution for us, and it gives us more understanding of your solution so that we can help determine if it's a good fit for moving forward in the I2 program. And because there are a number of questions that are going to require thoughtful responses, the best way to do it is to draft your responses outside the application platform itself. So create a Word document. You will have downloaded the application, we hope, from the webpage. And then pay attention to the word and character count as you go through editing. And when your responses are ready and you're happy with them, copy and paste them right into the online application. And while you're in that online platform, just for safety purposes, save it as often as you can as you're working through the application, because you never know when there's a blip in the internet system or whatever. And we don't want you to waste all that good effort that you've made. If you have any difficulty with the online application, email us at i2@alliancehf.org, and a member of our team will respond by email. If it requires a phone call, yes, we will be happy to jump on a phone call to help you through the application technical aspects of it. And let's see, just to repeat myself one more time, please make sure to apply earlier than the January 24th deadline. Um, Submittable is a type of platform that if you have not submitted it by 5 p.m. on the 24th, the platform shuts off access, even to us, of all unsubmitted applications. So we won't be able to access it, you won't be able to access it, and we won't be able to reopen the application for you. So 5 o'clock, January 24, get it in sooner than that, please. On the application itself, there's some information you're going to need and some attachments you're going to have to upload. So there's a table for gender and ethnicity to put down the data on your C-suite, your board, your staff, and volunteers if you'd like. We'll be looking for a tax ID number and financials, as well as your estimated total size of the market for your solution in San Diego County. The attachments are going to be your IRS letter of determination, and the financials are going to include audited financials, your balance sheet, Form 990, or if you happen to be a new organization, your financial projections will be acceptable. And everybody's will have to upload their organization logo. So as I mentioned, there's a lot of questions in this application. There's approximately 18 that need meaningful responses from you. And they're all about different aspects of these particular key areas. So the description of the problem that your solution addresses, the description of your solution itself, the size and nature of the market you're trying to address, the innovative aspect of your solution, and ultimately who benefits if your solution is successful. There's one financial table section we'd like you to complete. It just enter the financial profile data using the table that's in the application. This is required of all applicants. If your organization is new, you may not have all this information, in which case enter 0 for the areas that you don't have. And be sure to upload financial projections when requested in the application. And go back one slide, please. You'll see these big red circles. We need those cells of the application of the table filled out, please. So we want to see your annual revenue, total annual revenue at the top. And then as you enter the percentages on this table, please be sure that they all add up to 100% at the bottom there that's circled. All right. Next, here's the demographics table I mentioned for board staff and volunteers. The genders that we are using for this table are female, male, non-binary, and prefer not to answer unknown. Again, please be sure that all the percentages add up to 100%. And to ensure that we are inclusive, we have added of the population listed above, what percentage identifies as transgender. If you know the answer, please list it here. And if you don't, that's okay. Just please enter 0. All right. Thank you for all that attention on all that information. We're going to switch over to some questions. And while we're formulating some questions, again, here's a reminder. You can put your question into the Q&A at the bottom of the Zoom screen. After the session, you may have additional questions. Feel free to email us at the I2 address. Refer back to the FAQs. We will be updating those FAQs once we get done with tomorrow's Ask the Funder session and this one. And again, we'll put the recording on the webinar as well. And while we're getting organized for some questions, Sarah's going to talk a little bit about some of our past I2 awardees, just to give you a flavor for what's happened in the past.
Great. Thank you, Karen. Let's go to the next slide. Perfect. So these are just a few examples. As Karen mentioned, this is a program that's been operating this is the 13th cycle. So we have a lot of experience, but these are just some examples of, organizations you might be familiar with to give you a flavor. Project New Village was one of the awardees in the last cycle, and they're developing a good food district hub that's going to increase healthy food access for marginalized and low-income residents in a sustainable model with an urban agricultural related hub. They have a really cool kind of connected program that is very much driven by a long-term, long-standing desire by the community. Go to the next slide. Urban Restoration Counseling Center, also a recent awardee. This is an example of an organization that was taking, existing therapies, mental health support, but applying it to a community that had no access or had very limited access, and that where there were significant barriers. And so their Therapy for All program serves overlooked, underrepresented communities in San Diego. They talk about providing culturally relevant mental health care for people of color, by people of color, and have a very intentional approach to the next generation of therapists as well. And so our I2 grant is helping them sustain and scale their business in a sustainable manner that's not reliant on grants in the future. Interfaith Community Services is another great example. Our I2 award that year was to help them create and launch their Recovery and Wellness Center, which partnered with a federally qualified health clinic that improved, well over 1,000 lives each year for homelessness. And it's a sobering detox, long-term recovery and recuperative care program. And the seed funding allowed them to establish the program, which is now financially sustainable through healthcare funding. And then the last example we were going to share with you is CIE, Community Information Exchange. Many of you are probably familiar with them. This was a long time ago, but before CIE was established, we had 211, but there was nothing that allowed really interoperability of information about the clients that many agencies were serving. So CIE was established as a community-governed infrastructure that enables information to be effectively shared across many organizations that are supporting communities, in multiple facets. So it allowed for coordination of care, that should say of, not off, there's a typo, and improved client outcomes. So those are just a few examples of prior winners. And I think, Karen, I'll turn it over back to you to kind of kick off our Q&A.
Thanks. Yep. Yeah, we have a few questions here. The first one is, how will each phase be evaluated? So each phase of the I2 journey is evaluated using a set of key elements that Sarah walked us through earlier, and they're all relevant to each phase of the challenge. They kind of build on each other all along the way. The elements, again, just as a reminder, include innovative, community-informed, potential impact, feasibility, evidence-informed, additionality, market understanding, the potential for scale and sustainability, and the leadership team and coachability. We also had a question about the type of scoring that's done during these evaluations and whether there's an actual rubric or some sort that might be used. And the answer is that we don't use a specific scoring or weighting methodology. We work as a team of evaluators and carefully consider and discuss the proposed solutions based on a holistic set of elements that we just mentioned a moment ago. So it's a very dynamic, collaborative approach to evaluations, and it's worked really well for us in the past. Another question that is asked, let's see, are individuals eligible to apply? The answer to that is no. Lead applicants have to be a 501c3 nonprofit organization. Another question, can a social enterprise or collaboration of organizations apply? This is an interesting one. In the case of collaboration among entities, it's a yes, including social enterprises. There just has to be a 501c3 nonprofit organization as the lead applicant, but they can partner with social enterprises that might be benefit corporations. They could be non-501c3 organizations. They could be for-profit companies. But again, the lead applicant will be the one who is authorized to bind to all the participant organizations And that lead 501c3 applicant will also be the one to receive any applicable milestone-based grant funds. And if there's distribution that has to have in your collaboration, it's up to you. Let's see. I think we talked about that one. And again, what qualifies as a social enterprise? It can be a nonprofit, it could be a certified B Corp or for-profit organization that advances health equity and wellness for those in need. And I think that's all I need to say about that one. Let's see. Oh, here's a question. Are the workshops a requirement for participation? The workshops are not a requirement for participation and are optional, of course, for the participants. However, as Sarah said, they are a really valuable resource for you as you build your business model, and they're led by subject matter experts. There's absolutely no charge to the I2 applicants or the finalists to receive the workshops or the one-on-one coaching and mentoring. This is part of the capacity building and support that we want to provide all sorts of, really exciting, innovative models, recognizing that this program is only going to award one awardee. We want to be sure that your time spent on I2 is valuable, will take you to the next level in any pitch session you have to do for additional funding. Let's see. Are there any restrictions on how the $1 million may be spent? Again, the I2 grant, it's a milestone-based grant. And so consequently, the award tranches will be budget and project informed. The details for the grant will be customized to your innovation plan in coordination with Alliance and the team of advisors. So very customized grant program here. And let's see, another question. How long is the grant period for the I2 awardee? Does the funding have to be spent within a 12-month period? The grant period is, again, customized based on the needs of your solution and model and phased accordingly. So most prior I2 awardees, their grant periods have ranged anywhere from 1 to 4 years with Alliance. Let's see. If we don't track demographics for our volunteers, what do we enter? The volunteer section is completely optional. So if you don't have volunteer information, you can leave it blank. If for some reason the form doesn't want you to move forward, just put zeros in all of those in all those cells for volunteers, but it should allow you to move forward by just ignoring the volunteer column. Okay, what will reporting requirements look like? If your organization is awarded the $1 million grant, it will be milestone-based, so the milestones will be formalized as an exhibit to the grant agreement and will be derived from the content of the applicant's proposed final plan as described in its in-person presentation. So this will include details about recording. This will include the details about the reporting requirements. AH staff will also be regularly interacting with your team to support your success. Okay, someone is seeking some clarification that says if we don't get awarded until a mentorship, we don't get awarded until after a mentorship program. Is that correct? So we can't provide services during these months. All right, let's see. There's the $1 million award happens at the end of the program. That's true. You will be mentored throughout the program if you advance from phase 1 to 2 to 3. So there's constant mentoringship going on, and you're welcome to put your program into operation. So there's no reason to hold back on starting your solution if you haven't already. It could be ongoing right now and you're wanting to scale it further. So we don't hold you back from your work. It's important work and we want you to be doing it. Let's see. Here's a question that says, if we service residents in San Diego County, but are not located in San Diego, are we still eligible to apply? And it's okay to serve areas beyond San Diego, but you must, at a minimum, serve San Diego as a significant portion of your solution. So you could be an organization that perhaps is not headquartered in San Diego, but the solution you're proposing is going to pilot in San Diego or serve a large population in San Diego and then perhaps scale beyond San Diego. Those are all, that makes it eligible in itself. So it's okay to serve areas beyond San Diego, but at a minimum, you must serve San Diego as a significant portion of your solution. Let's see. There's a question here that says, is serving one specific population of individuals with intellectual and developmental disabilities a broad enough population base, or are you looking for broader impacts? This qualifies as an eligible, marginalized, underserved population. So this is a qualifying population. Says, do you require a logic model or letters of support? By phase 3, when you are submitting your final pitch deck and your final business plan and progress update, there is, I believe, Sarah, correct me if I'm wrong, but there is an opportunity to upload letters of support. We don't have it in phase 1, however, so you won't see that in this current application, but it is something we look to later on. But in the application that you're going to be filling out, you will have an opportunity to provide all sorts of narrative about your logic model, your partners, what they've said. So you can add some of that into some of the narrative pieces if you'd like. And someone is looking for clarification again on the incentive grants that we mentioned earlier. In phase 2, when we have up to 10 semifinalists, to support their work in furthering their solution, the semifinalists will be awarded $5,000 each. And by phase 3, up to five finalists that get selected for phase 3, each of them will receive a grant of $20,000 each. This is, how are you defining health and wellness? This goes back to the social determinants of health. And health and wellness is a very broad category. Sarah may want to jump in and help on this one as well. But health and wellness is access to health. It could be access to education, access to clean environment, access to transportation, access to mental health services. It's everything that goes into making your life a quality life. Could be workplace development, jobs, all things that make us healthy and well. So big, broad umbrella to work with. Sarah, would you like to add anything to that?
No, I think you covered that well, Karen. I think I would also just encourage, there's a lot more detail in the website material, written material about that, and also on our web's page around our perspective around health and wellness. But I just emphasize it's a social determinants of health view. So we're not just focused on healthcare. It's all the upstream elements that keep us well. And I'm getting a note that that's the end of the questions in the queue.
End of the questions. Yeah. That was great. Well, again, thank you everybody for joining us. We're really pleased that you have an interest in the innovation initiative, and start working on those applications, and reach out to us by I2 at alliancehf.org if we can be of any help. Bye for now.